Secondly, going back to the issue of the oxygen, the minister said he sees no need for an independent investigation, given the fact that the internal processes are at place. Just to repeat what our newsroom has reported before, we've had multiple sources across the island tell us that patients died that weekend because of the oxygen shortage, and fear of a cover-up is real. That's why people are asking for an independent investigation, Minister, in the interest of transparency and to indicate that there is no cover-up. So are you not willing to reconsider that issue? And finally, the PS said just now that parents are supposed to go with children to provide consent, but I've had several complaints about parents being separated from children when they get to the vaccine site. Surely this should not be so.
The other quick question around the oxygen and the need for an independent inquiry. I'm not saying that in these things one should not be open to independent inquiries. And I'm not even saying that in the case of this instance. What I said, and it's important to appreciate what I'm saying, is that we need to allow the internal processes to work. This idea of calling for an inquiry and just jumping over the internal processes, certainly it's hardly ever done in some spaces. I mean, you have a structure, and the structure should be given an opportunity to work. Now, if the structure doesn't work, then I fully appreciate that we need to improve on that, and it may be at that point that you need to have a more independent assessment. But I don't subscribe to the view that we should seek external help so frequently that we end up undermining the structures that we establish. Improve them where we must, but give them a chance to work. And in this instance, as I said, the issues leading up to where we are quite clear and transparent as it relates to oxygen and the availability of it. And so it's not like we're trying to hide something. Those have been made public. We've provided evidence of it in many cases in terms of the supplier not getting the overseas supplies that they wanted to or they ordered. And if they got it, we would not have had this issue. And then finally, on the people expressing their views about people dying and so on, you know, if we went by what people say on these matters, we'll be carrying the donkey to market, because I tell you, I've you know, a lot of these things we have to verify and validate, and people say all sorts of things for all sorts of reasons. I have to depend on the process and the clinical team to assess by getting the reports, and those reports are what inform my own position and how I influence the decision-making process. I cannot depend on hearsay, rumors, and innuendos to determine policy, because if I did that, then I wouldn't be providing leadership. I'd be allowing everybody else to lead me. And I don't see that as a role that I have once I'm in this position. Thank you.
So the issue of the separation of children from their parents, that is clearly not the standard operating procedure at any vaccination site that has to deal with children. I do know of an instance at a particular site where parents were being told, because of the size of the crowd, that they were separating children. And when we were alerted to this, we advised that this had to be stopped immediately. And it was corrected. But this was based on a particular element of the management of the vaccination center, trying to crowd control. But we had to explain that you can't take away the right of the parent in trying to administer the crowd at the vaccination site. So at this point in time, we are clearly indicating that once we are vaccinating children, the parent or guardian is to be there to provide consent.
I mean, okay.
The CMO wants to comment on this issue with the oxygen.
Yes, I really feel the need to comment, because I'm a little bit taken aback by the consideration that we're trying to hide debts. You know, the Jamaican health system does have a capacity, and from we started to manage the COVID pandemic, we have made it very clear that there was a capacity that if we did not keep the numbers below the capacity of the health system to manage, that we would have dire consequences. Over time, we have increased that capacity. We have increased the number of beds, we have increased the number of staff, we've worked tirelessly to secure personal protective equipment, training of staff, to provide more oxygen supplies. But the fact is that, you know, there is just so much that within our context that we can provide, because there are always limitations that prevent us from going above a certain level. And the fact is, if we go into a fourth surge and we remain with this much of our population unvaccinated, then the threat becomes real again, that we challenge the limitations of our capacity. And you know, on August the 27th, 28th, the health system was faced with a crisis that we ran low oxygen supplies in our hospitals, and the health team worked tirelessly to try to reduce the impact of this on our patients, and we were able to save a lot of persons. Now, there are persons that died over that period of time, and right now, so far, we're unable to say, was it directly as a result of the low oxygen supply, or was it a natural progression of their illness? And we have made a commitment that we are working on those details to try to find out. But you know, the thought that we are hiding debts really should not be entertained by the Jamaican public, because I think that we have been very, very transparent in what it is that we do and how it is that we have been trying to manage this crisis. And at times of challenges and crises, that, you know, we don't know how long this pandemic is going to last, and things may look good now because positivity rate is coming down and we're trending in a certain way, but then you don't know what's going to happen over the next couple of months. So when these challenges and crises come, I want the Jamaican public to understand that the health system, every member and team in the health system, works to try to prevent the bad impact on our population, and we work tirelessly to do so.